In this video, I'll discuss 10 medications that pose a significant risk to your liver health. Did you know that every medication and supplement you consume must pass through your liver? This organ plays a crucial role in eliminating chemical waste and toxins from your body. However, liver damage, known as drug-induced hepatitis, can occur immediately after taking certain substances or up to 90 days later. Unlike the kidneys, which can be supported with hemodialysis in cases of acute failure, the liver lacks a replacement machine. In the United States, over 2,000 cases of acute liver failure are reported annually, with half of them attributed to medications or supplements. While numerous medications can potentially harm the liver, there are 10 that are particularly notorious for their hepatotoxic effects. It's essential to be aware of these medications and avoid excessive use to safeguard your liver health. In this video, I'll delve into the early signs of liver damage caused by medications, providing valuable information to help you protect your liver while using medications and supplements. Before we delve into the intricate workings of your liver, like this video if you're intrigued by natural health solutions. If you're new here, hit subscribe and enable notifications for our latest updates. Welcome back. The liver plays a vital role in purifying your body, acting as a meticulous filter for everything that enters your system. Whether it's processing alcohol, medications, drugs, pesticides from food, or various environmental chemicals you encounter unknowingly, the liver handles these substances and eliminates their waste products through bile and urine. Due to this detoxification function, certain substances can pose a severe threat to your liver. What are the early indicators of liver damage caused by medications or supplements? These signs may include stomach pain, fever, diarrhea, nausea, vomiting, dark urine, pale-colored stool, jaundice, yellowing of the skin and eyes, severe fatigue, drowsiness, itching, and skin irritation. The timeline for medication-induced liver damage varies widely among individuals. Factors such as the dosage, age, concurrent use of other liver-harming substances, and pre-existing liver conditions like chronic hepatitis or fibrosis influence how quickly liver damage manifests after starting medication. Typically, symptoms of liver damage from medications can appear anywhere from 5 days to 3 months after beginning treatment. While I'm focusing on medication-induced liver damage, it's crucial to note that alcohol is a major contributor to liver problems, accounting for about 10% of liver transplants. Illicit drugs like cocaine also have detrimental effects on liver health. If you're taking any of the medications I'll discuss shortly and they were prescribed by your healthcare provider, it's essential not to stop them abruptly. Many medications are crucial for managing specific health conditions when prescribed and monitored by a healthcare professional familiar with your medical history. Let's explore the top 10 medications that pose a risk to your liver, with the number 1 being of utmost importance, so stay tuned till the end. Starting with number 10. Diclofenac. It falls under the category of anti-inflammatories like ibuprofen and naproxen, which have a potential but rare chance of causing liver damage. However, diclofenac stands out due to its elevated risk of causing liver injuries, which can surface weeks or months after starting its use. It's crucial to note that diclofenac not only affects the kidneys but also poses a threat to liver health. 9. The combination of amoxicillin with clavulanate, a widely prescribed antibiotic for various infections, carries a significant concern regarding liver injury. Despite its effectiveness in treating infections, it has been linked to numerous cases of acute liver injury, a severe condition that demands immediate identification and treatment to prevent serious consequences. 8. Amiodarone, primarily used by cardiologists to manage cardiac arrhythmias, is highly effective but comes with a notable index of side effects. Among these, liver damage is a potential concern, although acute liver injury is uncommon. It's important to monitor patients using amiodarone for any signs of liver issues, especially in prolonged or high-dose treatments. 7. Alopurinol, prescribed for elevated uric acid levels and gout, can also impact liver function. Liver injuries associated with allopurinol can occur relatively quickly after starting treatment, necessitating close monitoring and prompt medical attention if any symptoms of liver damage arise. Despite these risks, each of these medications serves vital therapeutic purposes, emphasizing the importance of informed medical supervision and patient awareness regarding potential liver-related complications. 6. Anticonvulsants, specifically phenytoin, commercially known as Dilantin, and valproic acid, often referred to as Depakote. Phenytoin has the potential to initiate liver damage soon after its introduction into the body. On the other hand, the effects of valproic acid on the liver may become evident between 1 to 6 weeks after starting the treatment. Regular monitoring of liver enzymes is crucial when using these medications. Additionally, carbamazepine and lamotrigine can also lead to liver injuries, although such occurrences are relatively rare. 5. Methotrexate, which is commonly used to treat various conditions like rheumatoid arthritis, psoriatic arthritis, and certain types of cancer, requires diligent monitoring of liver enzymes due to its association with liver injury. Liver damage caused by methotrexate can range from mild to severe, highlighting the importance of continuous monitoring and adherence to medical guidelines regarding dosage and frequency of use to minimize the risks of hepatic side effects. 4. Antifungals, particularly fluconazole and itraconazole. These medications, while highly effective in treating fungal infections like candidiasis and nail fungus, are associated with hepatotoxicity in susceptible individuals. Therefore, if you are undergoing treatment for fungal infections using these antifungals, it's crucial to be vigilant about the signs of hepatotoxicity mentioned earlier. 5. Methyl Doopa, commonly used to manage high blood pressure. While generally considered safe and often prescribed for pregnant women with hypertension, methyl Doopa has been linked to potential liver damage. Therefore, it's advised against using this medication for individuals already suffering from liver conditions such as fibrosis or cirrhosis. Awareness is crucial as adverse liver effects can arise up to 12 weeks after starting methyl Doopa treatment. Regular monitoring of patients using this medication is necessary to detect any signs of liver impairment early, preventing exacerbation and ensuring that hypertension treatment doesn't cause further harm to liver health. Patients with a history of liver diseases should consult their doctors for safer alternatives. 2. Antipsychotics such as risperidone and quetiapine, marketed as Seroquel, are used not only for psychosis but also for refractory depression, which doesn't respond to typical treatments. These medications can potentially harm the liver by inducing drug-induced cholestasis, a condition where bile flow from the liver is disrupted or reduced. Bile is crucial for fat digestion and waste elimination. When drugs like risperidone and quetiapine interfere with bile flow, it can lead to bile accumulation in the liver, causing hepatic damage. Patients undergoing treatment with these antipsychotics should undergo careful monitoring for any signs of liver issues. 1. Paracetamol, which is primarily associated with drug-induced liver failure. Typically, liver injury doesn't result from the standard dosage but rather from excessive amounts. Due to its widespread use, some individuals may misuse paracetamol by taking more than the recommended dose. For instance, instead of taking the appropriate amount for a headache, they might consume 3 tablets at once, repeating this overdose. It's crucial to note that the prescribed doses of paracetamol are safe. Doctors even administer it to infants to manage fever or pain without adverse effects. However, surpassing the recommended dose can be perilous. Of all the cases of liver failure attributed to medications, over a third are linked to paracetamol. An overdose of paracetamol can lead to acute liver failure, which has a high mortality rate and often necessitates a liver transplant if regeneration isn't possible. Unlike the kidneys, where hemodialysis can temporarily reverse renal failure, the liver, once compromised, typically requires transplantation. Moreover, factors such as alcohol consumption, genetic predispositions, and the concurrent use of other medications from the list can heighten the risk of liver injury. The damage to the liver caused by paracetamol usually initiates within 1 to 3 days after ingestion, with symptoms surfacing 2 to 4 days later. An antidote for paracetamol overdose, acetylcysteine, fluimucil, is available, which is effective in safeguarding the liver. However, In cases of exceeding the recommended dose, it's advisable to seek immediate medical attention at an emergency room and explain the situation to the doctor rather than risking the need for a liver transplant. It's crucial to understand that the absence of a medication from this list doesn't imply that it cannot harm the liver. The roster of medications with hepatotoxic potential is extensive and encompasses antiretroviral, vitamins like niacin, various antibiotics, supplements, and even herbal teas, as discussed in another video. The liver is a vital organ, and its malfunction can significantly impact overall bodily functions. To avert drug-induced hepatitis and, in severe cases, fulminant hepatitis, it's imperative to approach all medications with extreme caution. Fulminant hepatitis affects a notable portion of individuals with acute drug-induced hepatitis, leading to jaundice, yellowing of the skin, and among these cases, only 20% survive without undergoing a liver transplant. If you found this video informative, share it to spread awareness, subscribe to the channel, and stay tuned for more insights in our next video. Thank you.